again.
Good morning, everyone. I'm Sam from Sound Massage Therapy. I'm here today with the lovely Dr. Laura Forrest. I know Laura because actually she's a client of mine. And every time I see Laura, we have the most interesting conversations. So Laura's background is she is a lecturer and a researcher within sports science. And back in the day, she's done some really crucial research into the field of high intensity interval training, or we like to call it HIIT because it's much easier. So I thought it'd be really good to have a nice discussion with her about HIIT training, what it is, what forms it can take, some of the myths around it, and some of Laura's own bugbears about exercise. Now, what I want to say though is for a lot of you, you're probably thinking, high intensity interval training, really not something for me, but I would urge you to listen to this interview because there's so much interesting information just about exercise in general, okay? So what I'm going to do is let Laura introduce herself and then we'll get on with the interview. So Laura, a little bit of a background about you, please.
Hello, everyone. And thanks, Sam. So at the moment, I'm a lecturer in sport and exercise science at University of West of Scotland, where I teach undergraduate degree as well as have research students that are postgraduate research students. So going back the way to where it started, I suppose, I did my PhD in University of Glasgow, looking at high intensity interval training or very high intensity interval training, and more specifically sprint interval training. So I looked at very high intensity interval training from both a health perspective, which we'll probably talk about more today, as well as from a performance perspective. So just to give you a wee bit of background of what I've done from there. So I had the opportunity actually during my PhD from the performance end of things to work with British cycling and some of our very, very well-known cyclists that are now the stars of the world. So I was very lucky and fortunate to be in that position, and that allowed me to then go on to a position at the Institute of Sport, working with elite athletes and trying to improve their performance and training and competition practices, so working with coaches and athletes. Now, moving on from there, I then went back to academia to try and sort of pass on some of the knowledge that I've learnt along the way and experiences along the way. I still have an interest in high intensity interval training. My research focus isn't there now, but I still absolutely have an interest in that area, and it's very much now a topic that when I was doing my PhD, it was very much emerging in the health side of things. Not much was known at the time, and we had some really nice studies that came out that have now been well cited, so that's a good sort of impact from there, that side of things. So yeah, so now in the academic world and trying to teach the next generation that are coming out.
Fantastic. So let's start off then with what is high intensity interval training and what forms does it take?
Yeah, so you've hit me on the head there. It takes many different forms. I see it as very much as, well, it can be called, one thing, it can be called lots of different things. So it might be just high intensity intermittent training, or you might hear sprint interval training, or high intensity training, full stop. And I see it as being just short periods of vigorous intensity exercise interspersed with either rest or lower intensity exercise. And so what you get is these oscillations where you're doing very high intensity exercise, you're coming back down and then you're going back up. So peaks and troughs, and that's the sort of nature of high intensity exercise. Now, what we'd say is we know that it's been around for a long, long time. So for your listeners that are maybe your triathletes or your sporting people, then they'll have been using this type of training probably for many, many years. And we know that going back hundreds of years that athletes and endurance athletes have used this type of exercise. And first of all, I think it was reported with the Scandinavians using something called fartlek training, which is just a wordplay on speed play. So they're just changing the different speeds and coming back down and oscillating up and down. So we know from performance perspective that it absolutely works. But more recently, I think there's been more emphasis on that health side of things, especially the big drive we've got to try and reduce obesity levels and increase physical activity levels now that our lifestyles are so sedentary.
Okay, so what in your mind are the benefits of HIIT training?
Yeah, so I think they're vast at the moment. There's lots of different areas. One of the areas that's been probably looked at in most depth is something called your Vo2 Max.
Right.
So I don't know if that's a term that you've heard before or not. But,
I've heard of it, I'm not that familiar, so let's explain it for myself. And
yeah, for the layman's. No, it's very much, so it stands for maximum oxygen uptake. So it's a term that gets thrown around quite a lot in the performance sector. So for an endurance athlete, they'll need to have that high Vo2 max. It's a determinant of performance. It's not the only determinant of performance, but they will have to have a reasonably high Vo2 max. Now, when I say it's the maximum rate of oxygen uptake, it really reflects how much your body can take in. So the rate at which the oxygen goes into your body is taken up by the lungs, transferred through into the circulation, and then reflective of what can then be taken up into the working muscles, and then that oxygen used to produce energy for you to do exercise. So it's quite complex, but in terms of the Vo2 max is very important for performance, but we now know it's also very important for health markers. So it's a health marker in terms of it's been associated with something called all-cause mortality, so meaning that it's related to if you have a low Vo2 max, you're more likely to die of other diseases. So yeah, so you need to improve your health and your lifespan, then we know that having a higher Vo2 max or higher cardio, so people hear cardio and cardiorespiratory fitness probably. If you have a higher cardiorespiratory fitness, then you're more likely to live a healthy life. And so we know that it's very much so. It is crucial for health as well as performance. So we know this type of exercise. For example, in my PhD, we did a 2-week study where we had overweight sedentary males, and they came into the lab and they did something called sprint interval training, which is a form of high intensity interval training. So I should probably just actually stop and say, well, how do we define high intensity?
Yeah.
Because it takes very many different forms, and so in the community you'll probably see it in sort of MetaFit type things or Tabata intervals, or so lots of things around that side of things. We in the science world, we use different markers to sort of say, well, what is high intensity and what is high intensity, and it can be a measure using percentage of heart rate or percentage of that Vo2 max that you're working at, or different markers within the blood. But I think for the general population, high intensity is going to be exercise that you do that you will not be able to talk through. So if you're going out, so a lot of people probably underestimate what it takes to be doing high intensity exercise. So moderate intensity exercise would be where you are, maybe you're going for a brisk walk where you can still you can talk, but you wouldn't be able to necessarily sing or things like that. So you'd be out of breath a wee bit, but you could probably talk through it. High intensity interval training and high intensity exercise, you'll get to the point that you won't be able to have a conversation through it.
Okay. You can't sustain it for a long period.
You can't sustain it, absolutely. And that's why you have to have those oscillations, the rest periods in between, because you wouldn't be able to sustain it.
Yes, the average population is never going to have access to their Vo2 max levels.
No. Well, we do test that people from the population, general population, they do come into our labs and we do test them. But generally they're not going to have that sort of information.
And but more and more people are aware of their own heart rates through Fitbits and
yeah, absolutely. So there's much more wearable technology that can allow you into it. So some people go in heart rate bands if they're doing longer duration high intensity intervals. It doesn't quite work in the same way if you're doing the very, very short, because there's a lag in heart rate and things. So going back to the point in terms of Vo2 Max and it being really important, well, in that study we found that just 2 weeks when we've got overweight and sedentary males, that just 6 sessions within that 2 weeks. So we did it on a Monday, Wednesday, Friday. So we did 6 sessions of sprint interval training, and that sprint interval training involved 4 bouts of 30 seconds all out intensity against a fixed resistance on a bike, with 4 minutes in between. So it lasted around about, it's the type of exercise that can make people feel a wee bit nauseous, but often people, once that nausea goes, they feel really good afterwards. But it is all out, as hard and as fast as they can cycle. So that's the 30 seconds. So that's the extreme end, but a lot of the research in this area is now on that type of exercise, because we can control it fairly well. And what that study found, after just 2 weeks, we increased the Vo2 max of these individuals by quite a substantial amount. And we were able to improve other factors as well. So you're saying, what are the other benefits? So we're able to improve something called insulin sensitivity. So basically how your body is able to handle glucose. We now, unfortunately, we're in an era where we've got an epidemic of diabetes, and I think the recent stats suggested that it was 4.7 million within the UK have diabetes, and a large proportion of that is type 2 diabetes, which is often preventable. And it kind of relates back to, we'll get overweight and obesity epidemic, and we need to get people much more active. So what we found again from these studies, and this has been found in a lot of other studies, is this type of exercise. And it doesn't need to be every day, and it doesn't need to be over a long period of time. That it improved the body's ability to use your blood sugars, and it improved the insulin sensitivity side of things.
So would that then have an impact in balancing the blood sugar levels as well?
Yeah, so what it does is that when you consume foods, you release glucose or blood sugar into the bloodstream. You then get an insulin response that tries to bring that down. Now, when you get to people with type 2 or diabetes, the function of these elements doesn't work anymore. So exercise, we know, is a powerful tool to improve insulin resistance and insulin sensitivity. So we know that general exercise, and we know now that high intensity interval training allows us to do that as well. So it's a really good tool. It's not the only tool, and I think I should emphasise that it's not the only means of doing this. It's just probably one of many that can help. Yeah. And I'm just going to go on. It's not just your Vo2 max and insulin sensitivity. There's other areas as well. So it's been shown to reduce blood pressure. We all know that a lot of people in the population have high blood pressure now, and trying to maintain down to a level so you're not then going to have issues later in life with cardiovascular disease and things like that. So,
yeah. Okay, perfect.
There's lots and lots of benefits out there. I'm not even going on to the psychological benefits of exercise, because I'm more from a physiology background, but there's definitely the psychological and benefits of general exercise and well-being and how good you feel afterwards, and then it relates to self-efficacy and how you feel about yourself. So I think there's huge, and I think any of your listeners know how good people are, like how you feel after doing exercise. So, yeah.
And in terms of, because I know, whilst we don't want to put this emphasis on this chat, but in terms of weight loss as well, is it recommended for calorie consumption, burning fat?
Yeah, so it's an area that. So what my study found was that this type of exercise did increase something called fat oxidation. So how your body utilises fat after exercise. So it might not do it during the exercise, but after exercise, it did increase fat oxidation. Now, whether that increase in your ability to use fat within the body then translates to a weight loss per se, there's some folk that have within the literature that have found that weight loss has occurred over a longer period of time, but there's also others that haven't found that. And I think it's because weight loss is quite complex, and that you're not only just dealing with the exercise component, but you've got to think about the other elements associated with it, with people eating and your energy intake. So obviously weight loss is very much to do with energy intake versus energy expenditure. Now, if you reduce your energy intake and you increase your energy expenditure, then you're probably going to lose weight eventually. So we've got to be aware that there's other elements to this that in studies that go over a long period of time, you can't usually tell people to eat a particular diet for the exact number of calories and things. So during a free living, people will oscillate up and down in terms of their energy intake. So whether people lose weight at the end of the exercise will depend on the other lifestyle factors, as well as how much sitting down they're doing after exercise as well. So they could be doing this nice high intensity exercise, but do absolutely nothing the rest of the day. So and okay, your energy expenditure might be slightly increased the rest of the day because you've done the exercise and your metabolic rate's a wee bit higher. Whether that's statistically significant within, like if you were doing stats on it, but yeah, you can see small raises in energy expenditure after exercise. So yeah, I think it's more complex, if you know what I mean, in terms of the weight loss side of things. Not to say that it wouldn't, but I think we probably focus maybe sometimes too much on weight loss per se, because also we've got to think about, if you're losing weight and you lose it rapidly, then you're also going to lose muscle mass, and muscle mass is where we burn all our calories, or burn a lot of our calories. So you don't necessarily want to lose weight too quickly, because you will inevitably lose that good muscle that's actually burning your calories. So yeah, I think there's things to be said about, and also muscle weighs more than fat. So I think people get into a horrible cycle of focusing on pounds, as opposed to focusing on how do I feel and do my clothes fit me better. Because if I've been doing exercise, and maybe I'm doing some resistance exercise or body weight exercise, along with doing other types of exercise, then you're probably going to put on a bit of muscle mass, which is not a bad thing. We want that. It's good for us. And I think we go then too far, especially some of these companies that track lost pounds, that it's not the be-all and end-all. If you are within a healthy weight range, your body fat's within a healthy weight range, then I think we sometimes focus too heavily on the pounds at the end of the day. Does that make sense?
Yes. Can you explain a bit about losing muscle mass instead of a weight? Because that's really interesting.
So yeah, so that would occur if you, so a lot of people maybe go on yo-yo diets and things. If you restrict your energy intake too far, and you're not doing exercise alongside it, or you've not got the right protein intake to help maintain that muscle mass, then you will lose muscle mass. And muscle mass is one of the key things that helps increase our metabolism, basically. Yeah.
And so is there a link between HIIT training and metabolism?
Now the literature again on that side of things in terms of the energy expenditure can be variable. Now we know that fat oxidation can increase. My study didn't find an increase statistical, and this is where it's like you're going back to the science. It's a statistical increase, but what's a meaningful increase if it was done over a long period of time is different, because in the science world we tend not to or there's not many studies that look over longitudinally a long period of time. So my study didn't find an increase in energy expenditure, although if you to look at just the numbers, or where it was a small increase after exercise. Now I have to say that was done at 24, so the day after the last exercise bout, and then again a few days after the last exercise bout. So again, if you think about, if you take, so you need to be doing it fairly regularly in terms of your exercise every couple of days. There are studies that have, and it's not looking at energy expenditure, but more looking at that cardiorespiratory fitness side of things, that having longer gaps, you're able to maintain your Vo2 Max. There are studies looking a lot longer than I even would have anticipated. You're able to maintain that Vo2 Max. But again, you've got to consider the type of exercise, and these are quite high intensity in nature. So yeah, coming back to your point, I think it's variable within the literature. Yeah.
Okay. Any other benefits, or do you want to move on to some of your bugbears about how it's portrayed in media or other?
Yeah, we can. Yeah, I mean, I would say in terms of the benefits, there's lots of benefits. I think we just focused on a couple of key ones there. We could probably go on and talk about that. But yeah, in terms of, yeah, I do have a few bugbears within this type of literature, and probably more how it's portrayed within the media. I think there was a lovely study that was done looking at very short bouts of high intensity interval training, and then the media, and actually in some ways sometimes those working with in this area, we have part to play in it, that they'll say things like, 3 minutes of high intensity exercise a week will provide health benefits, or you only need to do 3 minutes of exercise a week and you'll be fit, that sort of thing. And I'm like, because if you take, it's not just 3 minutes, and it's not just any type of exercise. So yes, 3 minutes. So when you accumulate and you bring those high intensity bouts together, yes, they might make up 3 minutes, but you've got the recovery periods in between, and you've got obviously need a short warm up before, and you need a recovery period afterwards, or a warm down afterwards. So actually, if you take that into account, it is longer. Now there is research looking at what is the shortest amount of exercise you can get away with. So I'm not saying that it's totally out the window, but I sometimes think it's overinterpreted, that just saying to people that 3 minutes of exercise and you'll be fit. And I'm like, there's so much more to it than that. And the type of exercise they're reporting is this all-out high-intensity exercise, where it can sometimes make people nauseous and things like that. So yeah, so there's that side of things that does. So yes, I would say it can be time efficient. And so for a lot of your listeners, or postnatal, or mums, or whatever, then high intensity interval training can be time efficient. But there are studies now looking at even splitting it up through the day. So not just having one exercise session, but splitting up even into further smaller bouts. So there was one study by a group at McMaster University who've been quite prolific in this area, that I think it was something like they were doing stair climbs. So they're trying to translate the research from the lab, and that's another area that's not well done at the moment. We've done a lot of things in the lab and translate it into the real world, and what would be viable within the real world is not really being done as much yet. But they were looking at stair climbing, and I think it was, as far as I remember, the study was looking at 60 stairs, going up as fast as you can for 60 stairs, having, I can't remember the number of bouts of that, but then having 1 to 4 hours in between about, doing the same thing, running upstairs, having 1 to 4 hours in between, and then so 3 bouts of that a day, and they haven't found increases in this cardiorespiratory fitness, so Vo2 Max, over a short training span sort of thing. So yeah, there's research out there that's going on to try and make this more applicable to, because I think that's one of the things, and I have to say that even my research is very much, it's lab based, because as researchers and scientists, we need to know what works in the lab where it's controlled, and there's lots of control measures in there to say we know that if we're doing this, we get a response, and it's not got other factors that are affecting that response. So we do very much do things in the lab, but how does that work in the real world when you've got all these other influences that are coming into play? So for example, in my studies, for the days leading up to the measurements, they had to eat the same thing each time, that sort of thing. Yeah. In the real world, is that going to happen? No. And we appreciate that, but to be able to say, well, that effect is caused by X, Y, and Z, then we need to standardise a lot of things. So I think there's a lot coming out in terms of trying to translate that research. And that wasn't my bugbears, but that's on a different topic. I do this, I go into different topics.
Do you think high intensity training, do you think it's a be or end all, or what would you say to our listeners who are looking to get back into training and maybe thinking, oh, okay, I'll do some HIIT 3 times a week for the rest of my life?
One, that would be boring. No, and hard to do. No, I'm very much on this is very much a choice. It's an option within the menu of exercise in its entirety. I think that I think there's research looking into what people enjoy better, and it's there's conflicting evidence there. So some people love high intensity interval training, and some people don't. And so you go into the street and you have the same. Some people absolutely don't like it. They don't like how it feels. They don't like how they feel afterwards. And other people love that, and especially things like MetaFit and where it's group based. So there's other influences there in terms of working with people and meeting up with people and pushing yourself against the next person beside you. I see it's very much just a choice thing, that doing any type of exercise will be better than doing no exercise at all. Yeah. And mixing it up, depending on your goal of what you want to achieve. So obviously athletes, they already do this, they do a mix of training to try and stimulate and adapt their muscles. But the general population, if you're just looking for fitness, if you do things, that you enjoy, and do things that pushes the boundaries a wee bit. Now in terms of postnatal ladies or those that are just starting out, what I wouldn't suggest doing is going for high intensity intervals that are be careful. One, injury risk, especially postnatal ladies with pelvic floor potential issues or abdominal separation. So you've got to be very careful. So go to a physio first, make sure that you're clear on all those aspects, and then build it up slowly. So make sure postnatally pelvic floor is in a good position to be able to cope with that high intensity training. And
that would be a women's health physio.
Yes, a women's health physio, absolutely, yes. Yeah,
and there are, Laura's also in Glasgow, so we both know of some very good postnatal instructors who also do high intensity training classes, but it would be
a step-by-step process. So it's gradually getting that pelvic floor functioning better, then the core, getting a good core to be able to support before going on to do high intensity impact based exercise. And I think that's the difference between the different types of high intensity interval training. So I've very much spoken about the research that it's based on cycling, but obviously within the community, then it's usually your sort of circuit type exercises. So I think we've got to be really aware of that. And then the injury risk that can come with impact loading if you're doing it too much and not giving your body enough recovery time. And then you've got the extreme side of things where doing too much is also not good for you. And we end up, so for athletes, and there are some people in the general population that take it to the extreme and don't give their body to recover, and end up with issues, especially females, in terms of can end up with things like amenorrhea, where they stop getting their periods, or menstrual or hormonal issues. So, and that has health impact on bone health and things like that as well. So, yeah.
It's maybe something for people out there who do regular exercise and maybe sort of a lot of running, a lot of training, but have found that they plateau in terms of, their PBs. To then maybe look at something like introducing a high intensity
Absolutely, yeah.
into their schedule sort of once a week.
Yeah, once or twice, yeah. Change it up. Yeah, keep the body guessing. Yeah. So you do find that a lot of people, if they're just going out for moderate intensity runs, so they're going out either just at a jogging club or they're going out themselves, putting the headphones in, and they would just reach a stage where maybe their 5k time isn't getting any better, 10k time isn't getting any better, and they have generally plateaued, then you do need to stimulate your body in some way to adapt, and the way to do that would be through increasing the intensity. So if you're increasing the intensity, it has a lot of, so within the muscles, a lot of things go on, cascades of events start, and the body tries to adapt to that, and that will help with improving that even endurance performance. That side,
yeah. Right, Laura, anything else you want to add, or we'll start?
One of the things actually I should mention, and this comes back to our issues within the research, and especially given a lot of your listeners will be female, is a lot of the literature that we have done in the past, I have done in the past. I'm now moving into more female literature, but female research, sorry. But it has been done on males predominantly. Right. So can we translate all of this information to females? Yes, we can use elements of it, but do we 100% know that they'll have the same effect? I don't think we know that. Now, I'm not saying that high intensity interval training isn't going to work in females. There is a study again from this McMaster University, and I know they're now looking at the differences in responses with males versus females. And what they're finding, actually, interestingly, is that the responses are maybe not as high with females as they are with males. So unfortunately, females, another drawback to being a female at the moment. But it's not to say that there's not benefits, because there is. One of the things that's very difficult when you're doing research in females is we've got to take into account the fluctuating hormones, and that is not done very well at all at the moment. I'm not saying it's not. There's some people that are doing it well, but it's very difficult to do. Yeah. So you've got to track the hormone levels, and you've got to see, because, so for example, we know that fat oxidation, or how the body utilises fat, will change during the month. We know things like blood pressure will change during the month for certain people. Weight certainly fluctuates throughout the month. I mean, people just before their period can put on a couple of kilos, for example. So doing research with females can be difficult, but they are now doing. They're now focusing on high intensity interval training and looking at, well, what is the responses males versus females, which I think is great. So watch this space for much more coming out in terms of females. I'm certainly going into more research looking at sort of menstrual cycle issues and the impact on performance and impact on exercise and physical activity, that sort of thing.
Oh, fascinating. Yeah,
different areas. So we do need, so a lot of the literature has previously been done predominantly on males.
Yes,
yeah, we're getting there.
When you get that research done.
I know. I better get back to uni now.
No, that's fantastic. And yeah, I mean, that's a very important point, that, if you only ever do your research on males, then how do we know what was, we're not the same species. I know. Yeah. And I think there's been a dearth throughout a lot of the physiology in general, exercise physiology literature in general, until quite recently, and people are now recognising the need for it. So, which is great. Yeah. Well, Laura, thank you so much for coming in today and speaking.
Well, thank you for giving me the opportunity. Thank you.
If anyone has any questions can I point them in your direction, or? Absolutely,
yeah. Either via email, I'll give you my email address.
Yeah.
I'm not very good on Twitter at the moment. However, I will start that, and I'm at Dr Laura Forrest, so LOZFOZ. But I've not, I know, I've not started that yet, but I need to.
Yeah, get this out there because it is so interesting. But that's fantastic. Thank you ever so much for everyone listening at home. And if you have any questions, don't hesitate to contact myself or Laura. I can put you in Laura's direction. And until the next interview. And,
all right, okay. Yeah. Sounds good. Thank you very much.
Okay, thanks, Laura.
Speak to you later. Bye.